The impact and risk of chronic disease. Today, there's no denying the vast spread of chronic disease. Non-communicable chronic conditions have risen to affect more than 150 million individuals in the U.S. alone. That's 50% of our population who live with various forms of arthritis, high blood pressure, diabetes, glaucoma, depression, and more. And this figure is rising steadily. By 2030, it's estimated that the number of afflicted Americans will have increased 37%, adding an additional 46 million sufferers. Across the entire American population, the top 5 most common chronic conditions are hypertension, affecting 33% of the population, lipid disorders at 22%, upper respiratory diseases at 19%, joint disorders such as arthritis at 19%, and heart disease at 14%. The Medicare population looks much the same, with 37% of beneficiaries suffering from hypertension, 30% from hyperlipidemia, 20% from rheumatoid and osteoarthritis, 19% from heart disease, and another 19% from diabetes. Individuals with chronic diseases are at the highest risk of medical errors and duplicated or unnecessary services, due in part to the extensive effort and intricate care plans that this class of conditions requires. It's been estimated that as many as 50% of individuals with chronic conditions are not in fact getting the recommended care, which can extend patients' treatment time, medications, and of course, overall pain and distress. As a result, 7 of every 10 American deaths are caused by chronic disease. And of the 35 million individuals who die annually due to chronic conditions, half of them are under the age of 70. A greater problem is the population living with multimorbidity, or multiple chronic conditions. The fact is that many chronic conditions are comorbid, and the result is that almost 1 in 3 Americans, 97 million individuals, lives with multiple chronic conditions. And 1/4 of the chronic population have an astonishing 5 or more chronic conditions, warranting genuine concern. Who comprises this particular population? Multiple chronic conditions can affect all ages, but multimorbidity typically increases in prevalence as a patient ages. 80% of the population ages 65 and older lives with multiple chronic conditions. And multiple chronic conditions impact daily living and care costs. Almost half of the individuals have activity limitations such as difficulty walking, bathing, dressing, eating, cooking, or taking medications. MCC patients, again 1/3 of the population, account for 88% of home health care visits, 83% of prescriptions, and 70% of inpatient stays, which is why taking active steps to manage and assist our ever-expanding chronic care population is of chief importance. SmartCCM was developed to help chronic care professionals better manage their multimorbid patients without adding cost, time, or complexity. Their solution provides outsourced healthcare resources that allow physicians to provide the high-touch care that's vital to improved outcomes over time. SmartCCM provides certified chronic care managers who reach out by phone to Medicare patients each month. Under the advisement of the primary care physician, they assess the patient's state, assure they understand how to comply with the care plan, inquire as to prescription use, and provide feedback to the physician through the existing practice management software. Better addressing the global issue of chronic disease starts with each individual patient, and doing so will potentially save Medicare billions in expenditures and prevent millions of adverse health events worldwide.